Ageless Medica is a wellness company started by reputed doctors with an objective to provide holistic health and aesthetics solutions. Dr. Jagdeep Shah, a founding member, has 30 years of experience in the field of gynecology and cosmetogynecology with certifications from various institutes in the US. Dr. Shah has always been proactive in adopting innovative technology to further the cause of health and beauty care at Ageless Medica. Some of these health solutions are also offered at Pooja Hospital and Parak Hospital in Ghatkopar. Laser Vaginal Rejuvenation, LVR in its abbreviated form, is Dr. Shah's latest initiative in being the first to bring breakthrough technology to India. Dr. Shah will share with us the uses and benefits of this technology. Dr. Shah, can you please share more details about your company and why did you feel the need to bring this technology to India?
Thank you, madam. Thank you for your kind introduction. As you rightly said, Ageless Medica is a new dimension company with a philosophy of young forever. This company is started with an objective of providing different solution which up till now in India as a gynecologist very few people think about. We have three divisions. Aesthetic division provides an world class technology for looking good.
Okay.
And this looking good is without harming your health. So our slogan is change your look and change your life in anti-aging way. Similarly, we have division of anti-aging. This division caters the deeper need of health, fitness and longevity, which is far deep science as there is advancement of genetic and molecular science. The solutions of health, fitness and longevity to be provided to the people of India. This is the first company rather that this is ventured to provide similar solutions, which is far beyond the preventive solutions provided by many other companies. Our third division is cosmetogynecology division, and this is where as a gynecologist initially we are not trained, neither we focus on this, but I felt as a woman of this country needs to be given more services with respect to reproductive health, which we all do as a gynecologist, sexuality, functionality and aesthetic look to the private parts, and whatever psychological aspect of femininity associated with this subject. Now coming to the LVR, this is an exclusive machine, first time in India we are bringing this technology. The technology itself is innovative, though I have used this machine 5 years back in USA, but this machine is far better version of that machine and it gives excellent result. When we discuss further about this machine, I will tell you why it is required.
So, Dr. Shah, what exactly is LVR? Can you please explain the procedure?
Yes, madam. The laser vaginal tightening or rejuvenation is a laser based technology. You must have heard, madam, about the laser applications on the skin. What exactly laser is doing to the skin, which we do in our aesthetic division, is that it stimulates the skin structures, rejuvenate or regenerate the structures of collagen and elastic, and brings a tightening effect and glow to the skin. Similarly, vagina is an internal mucosal structure. Laser gives similar effect on this mucosal effect, and it generates the elastin and collagen tissue, and over and above this carbon dioxide fractionated laser with a proper pulsation, proper wavelength and proper penetration. It stimulates muscle also, and this muscle stimulation is really very effective as far as the support system of the pelvic floor is concerned. So this laser helps in tightening the vagina, and the most important part, with the muscular tightness, it helps to address the most difficult solution of stress urinary incontinence. Many women silently suffer from this, and this is the right solution without surgical intervention.
You just mentioned stress urinary incontinence. What is the incidence of the problem in India and what are the common causes?
Oh, it's a very nice question. As a woman, uh, many times after delivery, one feels that I have lost my original functions, original beauty, original strength, because the baby's head disrupts the lower vaginal tissue, and many times the recovery is not complete. So this laxity remains forever. Similarly, that head while passing, it will flatten, or it will make the muscles also thinned out, and that muscle being not exercised, the strength of holding the urine while we sneeze, cough, goes away, and woman starts leaking urine. So this is one part. Similarly, aging is inevitable for everybody, and this woman when grow old, the laxity further increases, the weakness further increases, and this results in either little prolapse coming out of the private part or more leakage of the urine. We call it as a stress urinary incontinence. So both this group requires this technology which can really help them to solve the problem.
So, how effective and long lasting is this treatment, LVR? And how many sittings are required and at what interval?
I am using this machine in India since last 8 months, and so many patients have treated. The principle is that when we stimulate the vaginal tissue with the laser, then the regeneration process starts, and the tissue regeneration takes 2 to 3 weeks time. So by that time the patients getting result, and they will perceive the result. But depending on the severity of the SUI, stress urinary incontinence, or depending on the laxity of this, we require additional sessions. So every 2-3 weeks interval period, we repeat this session. Some people require 2, some people require 4 to 5 sessions, but we expect the maximum result within 4 to 6 sittings.
And Dr. Shah, you also mentioned vaginal rejuvenation. Can you elaborate upon the need for vaginal rejuvenation and how LVR helps in that?
Just to add on what I have told you in the first question, that up till now the stress urinary incontinence was treated by surgical method, and depending on the stage of leakage, we classify as a stage 1, stage 2, stage 3. So mild to moderate, that is stage 1 and stage 2, we do a simple surgical repair. We call it as a Kelly's repair. Sometimes some people offer solution of Kegel's exercise. Kegel's exercise is not very effective, but this particular surgeries are really effective. The third stage, when the urinary incontinence is severe, then we offer a putting a artificial tape to hold the urethra. These operations are simplified nowadays quite an extent, but still it is a surgery. As far as this machine is concerned, the surgical need is nullified in mild to moderate cases. Now, as you asked about the laser vaginal tightening need,
Dr. Shah, you mean to say this is a non-invasive surgery. So, is there any blood loss or need for stitches or something?
Madam, I will tell you briefly about how the procedure goes. When patient comes, we assess the woman and we find out how much is the need for this treatment. Once we decide that no, this patient will be benefited, we counsel them, we show them that how the laser acts in the vagina, and we take the consent. Now, the crux of the management is that the patient is outpatient treatment. She was taken in operation theatre. She is relaxed and we give protective glasses to her. And then with this laser, it is very nice, comfortable vaginal probe we introduce in vagina. And within 10 minutes, the laser beam is applied in the entire vaginal wall. Once it is over within 10 minutes, we allow her to rest for 5 minutes and then she comes out. In this procedure, there is no anesthesia, there is no pain, there is no bleeding, there is no infection. So, the patient, as if it has come in office and gone out within 10-15 minutes without even feeling about the treatment.
So overall, this procedure will take how long from entry
Half
to
an hour,
exit? Half an
maximum
hour.
half an
And
hour.
no hospital stay required?
No hospital stay, and she doesn't even feel that I have undergone the procedure.
Okay. So coming back to my previous question, vaginal rejuvenation, can you elaborate upon the need for vaginal rejuvenation besides stress urinary incontinence?
Now, as I have earlier told that childbirth and aging, which makes the private part loose, and vaginal laxity we conventionally treat by doing surgery. We cut the portion of the vagina and we resuture the tube so that it becomes tightened. Similarly, perineal structure also we cut and tighten. That is our normal gynecological procedure. Now, the laxity itself is so inconvenient for many women that because of that many women get repeated infection because vaginal mouth is wide open. The perianal and perineal infection easily get access into the vagina and she gets repeated infection. That is one problem. Second thing is that she will feel the heaviness and sometimes low backache because of the reproductive organs coming down. That is another common complaint in women, low backache.
Okay.
Third thing is because of the part coming out, it gets friction with undergarments and it is very inconvenient and annoying, particularly for working women. Lastly, during the menstrual period, this some of the abrasive vaginal tissue get infected more and it gives more trouble. Sexuality is one of the important aspect of vaginal laxity. Many women, because of the lax vagina, they cannot feel their partner inside. And very joy or very happiness or very satisfaction of the sexuality is deprived if the vagina is very loose. So, vaginal tightening done by this laser technique can help in avoiding also many problems and help a woman to regain her femininity in whole.
Okay. And the procedure would be just like you would do in stress urinary incontinence. And how many sittings does this particular situation require?
Yeah, it is more or less same like stress urinary incontinence, but here the vaginal laxity degrees in anterior wall, in posterior wall or in uterine descent varies from woman to woman. So, accordingly we have to change the shots, the timing of the repeats of the shots and the number of sessions required. But still it holds same way that 4 to 6 sittings will give maximum results.
And again, that half an hour session.
Yeah, same half an hour session, same procedure. And the very interesting part, madam, in this is that this gives very lasting result
Okay.
because the regenerated tissue will never decay unless and until the age advances too much, or there is a disease which can affect the woman. So, this is a lasting solution and simple solution.
So, are there any side effects of the treatment? Like maybe because this is a laser treatment, which so is there any dryness in the vagina?
Absolutely, madam. Everyone is apprehensive when they hear about new things, they hear about lasers. The first thing in mind comes that is there any side effect, because in skin lasers there are incidences reported in newspaper that patient get burned and patient get disfigured. But fortunately, the company uh, has done enough homework before introducing this machine, and I have done enough homework with starting with the low dosage, low energy supply, and then I have seen myself in more than 50 patients that there is no side effect and no discomfort at all. So, we vary depending on the sensitivity of a woman, little or more energy to be given, and that is really effective.
Dr. Shah, as you said, it is a daycare procedure not involving hospital stay. But there must be some post treatment precautions. Can you please share those with us?
Yeah. The precautions are not very difficult. The laser energy, when it is given inside, it is always better to avoid sex for 3-4 days, and subsequently one can have sex. We take enough precautions beforehand only, that those who have vaginal infection, we don't give this treatment immediately. We treat the vaginal infection, then it. So, there is no question of having vaginal infection. The antibiotics are routinely not required. The analgesics are not required. Only if in outer part, if woman needs to apply because of little discharge, some ointment we give to apply to the outer part, but that is case to case basis.
And how soon can one return to work after this procedure?
Immediately. So, this is a rather a breakfast treatment.
Okay.
If woman is having breakfast break or lunch break in her office and she come to our clinic, she get treated and she goes home.
Can you tell us something about your technology partner, Alma Laser?
I am really proud to tell you that our Ageless Medica is associated with this Alma laser since almost now 6 years. The Alma laser is pioneer Israel based company which has got its major presence in America and European countries, as well as in some of the Middle East clinics. The innovativeness in the laser is brought by this company, and it has astonished the world that how laser can be made effective in the aesthetic treatment. So, we have laser hair removal machine already we were using since almost 6 years in our company. Similarly, we have a radio frequency very high standard machine of this company, and that has given phenomenal result in skin tightening, in face lifting, in shaping or body sculpting. And we were very happy that this company is having a breakthrough technology. When they came out with this machine, which I was aware of the technology, I thought that this will be another game changer as far as the gynecological management is concerned.
So you have had a long successful association with Alma Laser.
Exactly.
And that is why you thought, why not bring this technology also to India, where so many women can benefit from it.
And madam, this is the first time in India this machine is brought, and I have brought it with due caution and enough trial. So it is not that it is. I was also initially was evaluating that it is right thing to bring, and once I am very convinced about the effect of this benefits of this machine, then only I brought this.
Is there any other entity, any other clinic offering LVR in India?
No, absolutely no. This laser vaginal rejuvenation and laser treatment of stress urinary incontinence at present is not available anywhere in the India, and the company has started marketing aggressively in this, but time will tell.
Thank you, Dr. Shah, for providing us such valuable information and that too on a subject where there is hardly any awareness. And this is indeed good news that Ageless Medica has brought us a technology which is non-invasive, painless, and it hardly requires any post-procedure care. And especially for a condition which is generally overlooked but can have long-term repercussions on women's health. I'm sure a lot of women will take this opportunity to make the best use of LVR technology, which has come to India for the first time, courtesy Ageless Medica. And I wish Ageless Medica and Dr. Shah you the very best in your endeavor.
Thank you, madam.